For coming again, and thank you, Doctor, for being here as well. You said that you're a governor of the ministry and you watch everything you do. That is totally not true. The ministry, and the minister said herself, she leaves it up to the board to set the level of the French services for the, that determines the needs of the community. So that is not correct, what you said. I have a letter here, I was just handed here this morning. Well, another thing too, you said the hospital is tired of hearing negativity with respect to the ways the operation is going. I have 2,000 petitions here that there's a lot of people that are not tired of telling you that there's a problem there at the hospital. There's many people, many employees are not having the rights to advance. It's very obvious. I mean, these people don't stand out there in front of your hospital for nothing. And all of your own employees, you say you're getting along so great with your unions. Well, how many grievances do you have in there right now? How many grievances?
Excuse me, I can't answer that this morning. How many grievances?
I can. There's lots. Many. They're not. They're so far behind they can't even catch up.
Excuse me, Mr. Mayor. What I can say is that we have historically had very few grievances around the French Language Service Act, and that's because our contracts are centrally negotiated. And we abide by those negotiated agreements. And when we talk about the staff that are not happy, I did try to highlight for you the approach we're taking with the two unions that have not been able to come to an agreement on part-time advancing to full-time. We'd be happy to do that. We have indicated the willingness, and we have the board motion to demonstrate the willingness to waive the French language requirement, but we haven't been able to get that approved.
There's been many communities that have revoked the FLSA already because of the problems that exist, the division that it's creating in the hospitals. You didn't have to apply for this FLSA. You applied for it. Now, I have a letter here I want to read from the MP's office, if you don't mind. I've had these discussions with the Minister of the CAO and the Chair of the Toronto Community Hospital over the past few weeks, and it is clear that the board is responsible for determining the level of services required by the community, as well as corresponding staff policies. I believe the discussions over the past number of weeks will result in positive changes at the hospital, and I have heard over the union positive changes at the hospital, as I have heard that the union has already been working with management on some changes in full-time employment. This is an opportunity for the board and the community to review hospital policy and to ensure it meets the needs of all the community. The overall goal must be to ensure that we have the highest quality of health care possible the community demands, and we all agree with that. As the region's largest employer, the Toronto Community Hospital must also address the social and economic needs of the entire region. Some percentages of frontline staff must be capable of working in both official languages, and given percentages should be sufficient to address French and English-speaking patients and their families in their mother tongues across all shifts. How the Toronto Community Hospital meets the criteria is not covered by political positions, but by best practices on which we refer to them. He said he questions here about with respect with holding back funds. It could create a problem with the community. He also says, I also understand that sometimes the only way to get the message across is to impact funding. And I would hope the board is listening. The community is clearly asking for change in this hiring and promotion policies that will open up all but the designated positions to the 75% of the community's population and 96% of the province's population who are fluently bilingual. Doesn't make any sense here. But we all know that this area of Eastern Ontario is underserviced, that I agree with, and it comes to doctors and medical professions, and it benefits no one to accept policies that contribute to the problem. So he forwarded this to me. Now, I just want to ask a question. With regards to the FLSA and the impact of the current community hospital, could you please provide me with some further clarification as to why the Toronto Community Hospital thinks they are breaking the law? Again, the Minister of Francophone Affairs, Helene Periard, confirmed that the Cornwall Community Hospital is not ordered by the Ministry of Health to be designated under the Act, as you said. However, the Community Hospital insists that, under your quote in slide 4, Cornwall hospitals receive legislative directions from the Health Service Restructuring Commission. Is it possible for the public to see the documents concerning these legislation directions? Because the Ministry is pointing to the Cornwall Community Hospital, and you are pointing the Cornwall Community Hospital is blaming the Ministry. Who will give us a definite answer with respect to the ultimate responsibility with regards to provisions and level of French language skills at the Cornwall Community Hospital as well?
Thank you. First of all, I take great exception at the fact that you say I did not state something with honesty. The Ministry of Health does check how we are doing in terms of our language requirements. We must put together plans. We must also provide them with the statistics that go with it. And so indeed, we are required and we meet that requirement. As far as the minister saying that it is not mandated, I think you have misunderstood. She did indeed make a statement in the newspaper which said we are indeed legally obligated. But what Mrs. Jeanette Despati has also mentioned this morning is that we also have heart. And in our hearts, we want to provide service to all the patients, whether they be English or French. And so
Nobody has any, or just disagree with you with respect to hiring English and French and bilingual. We're just asking for fairness and giving everybody a fair opportunity, which is not happening at this time, to be employed or to be advanced. It's not happening. Everyone knows it. Everybody hears what's going on. I mean, my colleagues here, they know. They're hearing from the public. I mean, I'm not the only one getting these calls from the employees and from the community that there's a problem. Everybody is getting the same calls. They all know. And we have a motion here. I'm asking my colleagues to support. And it's just what everybody wants. When I was reading this here, I just misread this here, the positions. It says the community is clearly asking for a change in the hiring and promotion policies that will open up all but the designated positions to the 75% of the community's population and 96% of the province's population who are not fully bilingual. That's what I just read that. So, I have a motion here. I'm going to ask Helen to read, please. And it's moved by Tammy Hardy and myself.
Deputy Mayor McGillis.
May we finish asking questions to the hospital?
You read the motion. You read the motion and still ask questions after if you want.
Doesn't relate to the motion.
Well,
Doesn't matter.
why don't we finish with whatever questions council has, and then we'll do the motion at conclusion. Thank you.
Thank you, Mr. Ward.
Thank you, Mr. Ward. With respect to the board, just representation, how is the board comprised of? I've heard that there were 3 doctors on it, and there must be some lay people. Can you tell me the general composition? I don't believe there are any members from counties, are there?
we have members from the community, and so there are members from the county who are elected members of the board. So there are 12 elected members of the board. We have senior administration, and we do indeed have representation from the medical staff. And so that is how our group is comprised.
And this is by an application process. I think I saw one a few years ago. It's just
that would be correct.
Some of the, and it's nice to see you both here. I think a lot of times, I mean, without controversy, it would be nice, you know, on a semi-annual basis perhaps, because I believe communication can solve a lot of problems in many different cases. I just wondered if somewhere down the road consideration to creating a county's position could ever be considered by the board. We do have other, and it doesn't have to be answered today, but we do have other committees that we participate in, and it sort of brings information and voice back and the voice to the table. And not because of something controversial, but just as a funding partner. Thank you.
And we would welcome that input in having someone on the board. And as I say, we do have members of our board who live in the counties who are indeed elected members.